Hey everyone, it's Laura from Ortho Educator, and today we're going to continue talking a little bit about our lovely orthodontic terminology. So if you're going to your orthodontist and you're like, what in the world is he or she saying? I'm going to help you out with that just a little bit. So most of these terms, you'll hear them throughout your treatment, but most of them you would also hear at your new patient exam. So when you go in for your new patient exam, the doctor is going to do a diagnostic exam of your mouth. He or she is going to take a look and diagnostically say to the treatment coordinator, kind of the education and the sales part of the practice, say exactly what's going on in your mouth, and then from that, he or she decides, okay, what you need to do for treatment, what the modality is, braces, Invisalign, whatever it may be, how long you'll be in treatment, all that kind of stuff. So during that diagnostic exam, they will talk about several different things, descriptions of your teeth. And I would always tell my patients, like, if you hear the word severe, it doesn't mean like, oh my gosh, I'm the worst, the worst case I've ever seen of crowding. No, trust me, you're probably not. You've seen lots of stuff. But severe just means a lot, right? Mild means a little. Moderate means in between. Mild, moderate, severe. Doesn't mean you're terrible. It's just a lot of crowding. And you probably, if you didn't have a lot of crowding, you wouldn't be seeing us, so it's okay. But anyway, so crowding and spacing, right? You'll hear that. Crowding just means your teeth are crooked. There's not enough space in your arch form for all of your teeth to be at least how they are right now, and so they're twisting and they're turning and they're going front and back and all that kind of stuff. Spacing means your arch form is maybe nice and broad and wide, your arch form being kind of the bone trough that the teeth sit in, that U shape. Or maybe you have small teeth, right? But for whatever the reason, you have spaces between your teeth. And so part of your treatment is going to be figuring out how does the orthodontist close all of those spaces. So spacing and crowding. Then we have overbite and overjet. A lot of people think that overbite and overjet is the same thing, but it is not. Overbite is how much the top teeth overlap the bottom teeth. So when you bite your teeth together and smile, how they overlap there in the front is your overbite. And some people have too much overbite, meaning that their teeth overlap the bottom teeth too much, and this could cause future issues like wearing down the, incisal edge, the like biting edge of those front teeth, which we don't want. So too much overbite. Or some people don't have enough overbite, maybe they have an open bite, meaning that their back teeth touch together, but in the front it doesn't come together. Well, that could cause issues because you can't bite into your food, but also you're putting improper pressures and wear on the back teeth. So that's overbite. Overjet, though, is different. So overjet, here's a side view of the teeth now, is how much the top teeth stick out from the bottom teeth. So too much overjet could be because your teeth are tipped in the front, and so you have like bucked teeth or flared teeth, teeth that protrude forward. Or it could be that your bite just doesn't fit right, and if that lower jaw is too far back, well, that's going to make those upper teeth look like they stick out, even though they might be in the right place, and that lower jaw really needs to come forward to meet it. So overbite is too much, overbite is talking about the overlap of the teeth, and overjet is talking about that side relationship of the teeth. So that's spacing and crowding and overbite and overjet. Then you might hear them talk about the arch width, and again, that just means, the U shape, the bone trough that the teeth sit in, or the palate, which is your upper jaw, how wide, how narrow that may be. So they might say that, you're too narrow, which if you're too narrow, that could lead to crowding. Or maybe you're overexpanded. Sometimes if you have a really big tongue, it can actually overexpand everything, and so then maybe you have spacing. So we'll talk about your, your arch width, if it's constricted or expanded or whatnot. And then, let's see, and then we have how your bite actually fits together. So when you talk about your teeth coming together, and I talked about this in a previous video, but you have class 1, class 2, and class 3. And what that is talking about is the interdigitating of the teeth. So if you look when your teeth bite together, you want your teeth to kind of like look like a little zigzag zipping up together, right? The middle of one tooth fitting in between two teeth on the bottom. That's what you want. And that's called class 1 bite. But if the lower jaw is too far back, then that's a class 2 bite. And if the lower jaw is too far forward, that's a class 3 bite. And they both can cause the same issues, which again is just improper wear because you're not biting together correctly, you're not sharing the forces of biting and chewing. And so over the years, not when your kid is 15, but when they're 50, you could have gum recession, you could have bone issues, you could wear down the edges of the teeth. Worst case scenario, you could crack the teeth, right? Just things you don't want to do. So orthodontics is helping you get into a more functional bite, and for like a preventative reason, right? For having the best long-term dental health that you can. So those are the bites. The last thing we'll go over, just because I think it's kind of a cool thing, when it'd obviously be cool if you had it, but it's just interesting for us people who think teeth things are interesting, but his jaw can't. So when you look at someone and they smile, you want, you know, their smile line, which everybody kind of, well, orthodontists have different ways of like making sure that it goes with the lip line and things like that. But in general, you want the smile line not to be flat, but you want it to be straight, right? So, you know, my cuspids, like my pointy teeth, on each side are about the same level, right? And the same with the lateral incisors and the same with the central incisors. But some people, just by the way that their body is made, they have a jaw cant. And so if you hear the orthodontist say that you have a jaw cant, that's definitely something you want to talk a little bit more about, because what it means is that your jaw is canting either down to the right or down to the left. So when you smile, it may look like literally your teeth slant down to one side or slant down to the other side. Sometimes when if your teeth are really crowded, it may not be that noticeable, that specific thing. The orthodontist will notice it, but you may not notice it because everything's just kind of a mess. But as the orthodontist straightens everything, then you truly see it and you're like, wait, everything's straight and great, but it's all kind of tilted down. And that's why it's good to have that conversation beforehand with the orthodontist, because you'll know what to expect and you'll know like, okay, we're doing this and then we're gonna have to do this to then fix the jaw cant, or, you know, what is it that I have to do to fix the jaw cant? Is that something I'm willing to do or willing to have done to my child, right? Like, those are just some things to talk about. But anyway, so jaw cant is how, if, you know, the jaw tilts one side to the other. So anyway, those are just a little bit more of the terminology of orthodontics. I hope this helps you, you know, be a little bit more informed, understand a little bit more what the orthodontist is talking about. Of course, they'll break it down to you in terms that you can understand, but as you're going through that diagnostic exam and you hear them talking about expansion and crowding and class 2, you know, like, okay, they're about to say I need treatment. I know I have a few different things going on. So hope this helps. If you have any questions, let me know in the comments below, and have a great day. Bye.